Thank you. I'm a user experience designer, and for the last 2 or 3 years I've been working with clinicians to develop personal care plan tools that are driven by citizens, primarily with long-term conditions, and work within the UK's NHS. National Health Service. So just a bit of background, you probably know this, but 15 million people in England will have long-term conditions. That's 1 in 3 of the adult population, and it's set to rise to 23% over the next 25 years. The UK economy is going to lose £16 billion over the next 10 years because of early deaths from diabetes, heart conditions and stroke. And treatment and care of people with long-term conditions accounts for 70% of the primary and acute care budget in the UK. So what that really says to me is that we have to be able to be more responsible for our health. But we also need to have the support, the tools, the environments, the ambitions to enable this to happen. And we need to work within general practitioners, what the general practitioners and what the hospitals do. So I want to share some experiences of 2 kind of citizen-generated type projects in the UK. First, personal care planning in the West and East Midlands of England, and this is about generating citizens who know more about their care and more about the situation and planning, and develop more activated citizens who feel empowered to manage their care plan and well-being, and possibly to generate benefits as well. So one project is an interesting one. It's from Cambridge, and it's almost like Facebook. It's instead of having a profile, you have a personal care plan which you can share and manage. I've also been working on a similar project where it's enabling the citizen to reflect on the long-term condition and to understand how it affects their life, what's good, what's bad, what they want to change, what they want to stay the same, what the priorities are, and from that they can then create a care plan which hopefully improves their well-being. So with these kind of pilots, there's a lot of them, which is good. There's general excitement and enthusiasm, which is good. But it's really slow to get statutory buy-in, statutory sector buy-in. And that's what's holding a lot of things up. So developing the second project I want to talk about is personal health records for citizens. The NHS, the UK Government's Technology Strategy Board and NHS 24 in Scotland want to start a revolution where citizens create and manage personal health tools. So here's a good example, an e-red book. A red book is given to parents when they give birth to their first child, and it is the child's health record. There's now creating an e-version of that. You can imagine the digital advantage of that, but it's also an opportunity for citizens to create a personal health record for themselves and their children. A better plan is also a planning tool, but it plugs onto a personal health record, and it also attaches to a social network, so it enables circles of support to rally around individuals in their time of need. No Delays is a video resource that allows GPs to package up videos about conditions, send them off to patients so that they can review them in their own time and understand more about their condition and more about how it might affect them. So there's a lot of enthusiasm and a lot of partners getting involved in citizen-generated health information and data, and they understand the importance of it, but there's still a lot of challenges. So, for example, we need to help the statutory sector, the health sector, buy into the concept of a patient owning a personal health record. And we need to work with the health sector to identify and embrace the possibilities. And we really need to work hard to make sure the tools meet the user's needs. We need to help the statutory sector differentiate between health and well-being and clinical opportunities, to differentiate between clinical tools, expert systems and consumer environments, and with the citizens now sharing risk, that's a big deal for the NHS. So all the successful projects I've seen have clinicians, designers and technologists on the team. And they have clear guidelines to enable the NHS to choose the users that will benefit for this type of stuff. And I guess what we've learned is citizens are a massive untapped resource for the NHS in the UK. It's really quite difficult to design digital health services, and designing them well is really difficult. And to come back to what I said earlier on, we have to be more responsible for our health. But if we're going to create tools that allow citizens to generate data, we need to make sure that we give that the very best possibility that it's used well within a clinical setting. I hope that made sense. It's a bit of a Wurlitzer tour to a couple of different projects, but I hope it provoked some thoughts. Thanks.